Days back, a baby had come to my clinic, and the mother complained that baby had fever, had runny nose, had a cough, and some abnormal voice which he was doing as the baby was breathing or while the baby was crying. And the baby presented to me this way that I'll be playing for the next 20 seconds. The baby's presentation, he was irritable, he had fever at that time. Whenever he was crying, he was making a peculiar sound like this. Okay, now this sound is called stridor. And what is this? This is called croup. C-R-O-U-P. Now what happens in croup? Now basically croup means infection of vocal cords. Now where are your vocal cords? They are just above your trachea. Okay, that is the main air pipe. Now when the vocal cords move, we start making phonics, or our voice is coming out. Okay, but when there is swelling of these vocal cords because of some infection, which is usually a viral infection, then we get this type of croup. Okay, now the sound that is being made is called stridor. That is when the baby is breathing in. Okay, the vocal cord, instead of opening, will try to close, and that's why the sound is coming. This infection is very common in children, very common in children, and is many times self-limiting. You need to be careful about few things. Manage the fever in the baby. How? By giving the fever medicine after checking the baby's temperature. Secondly, see that the baby is well hydrated. Keep the baby's runny nose or blocked nose in control by using saline nasal drops, or if it is really too watery and runny, then your doctor will prescribe you certain specific nasal drops, those drops. Okay, let the child be cool, calm, do not disturb the baby. If the baby is not eating, please do not force the baby to eat. Let the baby drink a lot of fluids to keep the child hydrated. Now what are all those things that you can give or for the baby to drink? Rice water, dal water, tender coconut water, barley water, clear soups. Okay, this all can be given to the baby. Also see that when the baby is having fever, please keep the baby cool by using cool sponging, or I say cooling methods, that is tepid sponging, and I prefer it to be done with just your bare hands. Okay, I don't want any cloth, I don't want any sponge. Just wet your hands in water and then wipe the baby top to toe with normal tap water. Plus see that you move around with the baby without disturbing the baby much. Okay, and do not wipe the baby's, the layer of water which is there on the baby, do not wipe it. Okay, let the baby's body heat evaporate that body water, and see that the baby is coolly sleeping at home or resting at home. Okay, now within 1 or 2 days the baby will improve with the simple medications which your doctor is going to prescribe. Usually they don't even require an antibiotic. Like this patient of mine was not at all an antibiotic. Okay, and after 2 to 3 days, this is the same baby that we received in the clinic will be playing.
अच्छा हाय कर हेलो
हाय कर
हाय हाय
हाय कर हाय कर हाय कर
हाय नो नाम हाय म्हण मरे
बाबा हाय म्हण मरे डॉक्टर हाय म्हण
No.
So in nutshell, croup is something which really sounds very horrible. Okay, it sounds very horrible in the sense, wow, what happened to my baby? My baby is barking like a dog. Okay, and sometimes it can just happen overnight. Okay, means you, like, baby was totally normal now, but overnight he has some fever, he has some runny nose, and the baby starts having difficulty in breathing, starts having stridor, starts having abnormal cough, is very irritable, doesn't want to eat, doesn't want to sit, just wants to cling. Okay, all those things can start just like that overnight. Okay, but if it is croup, then this is what your baby will go through, and after 2 or 3 days with the proper treatment, the baby will be the other way that I had shown in the second video. So mamas and dadas, Do not get scared of croup. Just keep yourself informed. Information is very important. When you know what you're facing, you are less anxious. Okay, my aim of making these videos is basically to inform parents what are the different conditions that can affect your baby, what you should do, the TLC, the tender loving care that you should be doing, and the confidence that you should be having in your pediatrician. Bye bye.